And it goes a little something like.
You all summer and after I'll keep you all summer and after I'll keep you all summer and after I'll keep you all summer and after
Yeah.
you all summer and I'll keep.
Hi guys, and welcome back to another episode of Living on Lies, the nutrition show for the youth. And although today will be a short episode, hopefully you guys will learn something today. And we're your hosts, by the way, Jesus and Titivo.
And yours truly, Ralph Gahal.
Okay, for today's episode, with the help of our duly invited guests, we will be creating a diet plan primarily focusing on adolescent patients, or young teens, young adults, or people our age who have asthmatic problems.
So we went ahead and invited some knowledgeable nutritionists who are willing to help and teach us about this chronic illness. Let's welcome Zoe Dubduban, Christian Galion, Gabriel Alivio, and lastly, Hannah Amparo.
A round of applause, please. Okay, so for a brief overview of today's topic, according to the World Health Organization, the world's most common respiratory disease is actually asthma. And despite substantial changes in the diagnosis and treatment of this disease, asthma still remains poorly managed in the majority of the world today. So, to help against this issue, you all have suggested the implementation of a diet plan. Why so?
Well, Jesus, firstly, it's because of the current COVID-19 virus. Though there isn't a direct link between asthma and increased COVID-19 risk, and despite mild asthma being listed as a mere minor risk against the virus, sufferers of moderate to severe asthma have been stated by the CDC to have a possible higher risk of developing more severe symptoms. Secondly, just as you said, asthma is considered to be one of the world's most common respiratory diseases. Aside from that, it's also chronic, meaning that patients often have to deal with the disease their entire lives. So because of this, we have decided to propose a diet plan to help improve patients' quality of life, and especially for those asthma patients who cannot readily access asthma medications.
Oh, so that's why. But I haven't really heard much about how a diet plan can affect a person's respiratory health, or moreover, how eating affects how we breathe.
It might come as a surprise, but our dietary choices can actually still affect our respiratory health. So for asthma patients in particular, there have been studies that proved how eating more fruit and vegetables lessens risks of developing and aggravating asthma symptoms. While there have also been studies that link increased dairy consumption with higher risks of developing and worsening asthma symptoms. Aside from that, there also exist trigger foods that worsen asthma and also differ from person to person.
I did not know that. Wow. Jesus, did you know about this?
I am on the same boat with you here, buddy.
I should really take notes for this one, since I'm asthmatic myself. People like me should really be careful on what they eat, huh?
Asthma can also cause or worsen certain conditions, which is why it should be handled with care. Indubitably, asthma can possibly cause respiratory acidosis, which is when the lungs are unable to release carbon dioxide from the body, as you can see in this picture. The body's regular blood pH is 7.35 to 7.45 as shown in this pH chart. However, the buildup of carbon dioxide causes the body's blood pH to flow from below the regular, making it more acidic. There are two kinds of respiratory acidosis, acute and chronic. Acute respiratory acidosis is an immediate medical emergency and happens much faster than chronic respiratory acidosis. Chronic respiratory acidosis, however, is developed by the body. A person's body usually tries to adapt to the high acidity levels. For example, the lungs produce bicarbonate, which is alkaline or basic. to counteract the high acidic levels. Aside from that, asthma can also worsen acid reflux, which is when the stomach acid flows back into the esophagus. Researchers aren't exactly sure why asthma worsens acid reflux though. We do know that the lower esophageal sphincter relaxes in asthma flare-ups. As shown in this picture, the sphincter is that area between the stomach and the esophagus, and relaxing the sphincter opens it, allowing the stomach acid to flow up, which is what happens in asthma flare-ups. Also, some asthma medication like theophylline worsen acid reflux. So yeah, making certain changes to certain eating habits and adopting newer ones can help take care of respiratory and lung health for asthma patients.
I didn't even know that asthma could lead to a more dreadful condition. You guys surely had to do a lot of research before coming up with a diet plan. In that regard, may I ask, how did the process of making a diet plan went? And how did you guys organize your information?
After developing our hypothesis, we then develop our main premise. It's quite simple really. Having a diet that has proper nourishment is good for the body. The body is healthy when you eat the right amount of food, and as you eat, it helps in the production of cells and other important components needed for the body. Therefore, creating a diet and sticking to it would help your body improve and solve the problems that you are facing. From then on, we went about our research, and that's how the diet plan came to be.
Wow, it's really cool how organized you guys are. Well, I think that's the cue to see the fruits of your hard work. Could you please introduce everyone who's watching us your prescribed diet plan?
Certainly, JP. However, before we go through the diet plan though, the following steps are recommended to do beforehand. Number 1. Consult a professional. Discuss things first with a designated doctor and pediatrician. Depending on the asthma patient's condition, treatment may vary. Taking on a diet plan may not be as effective as one with atopy and rather would only further worsen one's condition. Thus, do not forgo a diet plan without seeking a health professional's permission and guidance. Number 2. Be knowledgeable and take note of the following. Firstly, personal allergies, most especially when it comes to food and beverages. Number 2. Trigger foods when it comes to asthma. And lastly, the recommended calorie intake per day from a health professional. Now that it's out there, the diet plan, we go. So first, these are the few of the many foods that are beneficial to asthma. And then here are the food that one should most likely avoid. However, this does not mean that you should completely stop taking intake of the following foods. However, we only suggest only to a minimal amount that it will not risk the health of the asthma patient. And from that, we could make up with a sample diet plan like this.
Once again, this will vary from one patient to another. Remember, always seek a professional's validation before foregoing a diet plan. Thank you so much for the very detailed diet plan, Ms. Dubduban. It was very helpful and I even took down some notes. But sadly, it seems that this is all we have for today, folks. Thank you so much for our guests for making the session as enlightening as it was. And to you, our audience, for tuning in, of course.
I hope you all learned something new from our very informative session because I sure did.
Well then, till next time, this has been Jesus Negativa
And Ralph Cahal,
of Living and Lies. Stay safe and bye-bye.
bye bye.